Welcome to Public Health Brief. Millions of people feel healthy today, but their blood pressure is silently destroying their heart, brain, and kidneys. No pain. No warning. Until it's too late. In this video, you'll discover why hypertension is called the silent killer and how knowing this one thing could save your life. Stay with me, because what you're about to learn is something everyone must know. Hypertension, commonly known as high blood pressure, is one of the most widespread and dangerous health conditions in the world today. It is often called the silent killer because it can exist in the body for many years without causing noticeable symptoms, quietly damaging vital organs until a serious complication occurs. Millions of people live with hypertension without knowing it, and many only discover the condition after experiencing a heart attack, stroke, kidney failure, or other life-threatening event. Understanding hypertension is not just important for patients, but for families, communities, and society as a whole, because prevention and early control can save countless lives. Blood pressure is the force of blood pushing against the walls of the arteries as the heart pumps. When this pressure remains consistently too high, it puts extra strain on the heart and blood vessels. Over time, this strain causes the arteries to become stiff and narrow, reducing blood flow to essential organs. The heart is forced to work harder to pump blood, which gradually weakens it. This process happens silently and slowly, which is why hypertension is so dangerous. A person may feel healthy and active while serious damage is already taking place inside the body. One of the reasons hypertension is so common is that it is closely linked to modern lifestyles. Changes in diet, reduced physical activity, increased stress, and urbanization have all contributed to rising rates of high blood pressure around the world. Excess salt intake, high consumption of processed foods, unhealthy fats, and sugary drinks play a major role in increasing blood pressure. At the same time, many people spend long hours sitting, whether at work or at home, with little regular exercise. Stress from financial pressure, work demands, and social challenges also triggers hormonal responses that raise blood pressure over time. Although hypertension can affect anyone, certain factors increase the risk. Age is an important factor, as blood vessels naturally become less flexible as people grow older. Family history also plays a role, meaning that people with close relatives who have hypertension are more likely to develop it themselves. Being overweight or obese significantly increases the risk, as excess body fat forces the heart to work harder. Smoking damages blood vessels and raises blood pressure, while excessive alcohol consumption disrupts the body's ability to regulate pressure effectively. Conditions such as diabetes and kidney disease are also closely linked with hypertension, often making it more severe and harder to control. What makes hypertension especially dangerous is the lack of early warning signs. Many people expect illness to come with pain or discomfort, but high blood pressure often develops without clear symptoms. Some individuals may occasionally experience headaches, dizziness, or fatigue, but these signs are not specific and are often ignored or blamed on stress or lack of sleep. By the time noticeable symptoms appear, serious damage may already have occurred. This is why regular blood pressure checks are essential, even for people who feel completely healthy. If left uncontrolled, hypertension can lead to devastating complications. One of the most serious outcomes is heart disease. High blood pressure damages the arteries that supply the heart, increasing the risk of heart attacks and heart failure. It also contributes to stroke by weakening blood vessels in the brain, making them more likely to burst or become blocked. The kidneys, which filter waste from the blood, are particularly sensitive to high pressure. Long-term hypertension can lead to chronic kidney disease and, in severe cases, kidney failure requiring dialysis. Vision loss can also occur when blood vessels in the eyes are damaged, and cognitive problems may develop due to reduced blood flow to the brain. The good news is that hypertension is largely preventable and manageable. Lifestyle changes play a powerful role in controlling blood pressure and reducing the risk of complications. Eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins help support healthy blood vessels and heart function. Reducing salt intake is especially important, as excess sodium causes the body to retain fluid, increasing blood pressure. Choosing fresh foods instead of processed ones can make a significant difference. Regular physical activity strengthens the heart, improves circulation, and helps maintain a healthy weight. Even moderate activities such as walking can have a meaningful impact when done consistently. Stress management is another crucial aspect of blood pressure control. Chronic stress keeps the body in a constant state of alert, releasing hormones that raise blood pressure. Finding healthy ways to cope with stress, such as relaxation techniques, prayer or meditation, adequate sleep, and social support, can help calm the nervous system and protect heart health. Avoiding tobacco use and limiting alcohol consumption further reduce the strain on blood vessels and improve overall cardiovascular health. For many people, lifestyle changes alone may not be enough, especially if blood pressure is very high or if other health conditions are present. In such cases, medication becomes an important part of treatment. Blood pressure medications work in different ways, such as relaxing blood vessels, reducing fluid in the body, or slowing the heart rate. When taken correctly and consistently, these medications are highly effective at preventing complications. It is important for patients to follow medical advice, attend regular checkups, and never stop medication without consulting a healthcare provider, even if they start to feel better. Community awareness plays a vital role in the fight against hypertension. Public education campaigns, community screenings, and access to primary healthcare services help identify people with high blood pressure early. In many low- and middle-income settings, limited access to healthcare means that hypertension often goes undiagnosed and untreated. Strengthening community health programs, training health workers, and encouraging routine blood pressure checks can make a major difference. When communities understand that hypertension is a serious but manageable condition, stigma is reduced and people are more likely to seek care. Family support is equally important. When family members encourage healthy eating, physical activity, and medication adherence, individuals with hypertension are more likely to succeed in controlling their blood pressure. Simple actions such as preparing healthier meals together, exercising as a group, or reminding loved ones to take their medication can have a lasting impact. Children who grow up in households that value healthy habits are also more likely to maintain normal blood pressure as adults, reducing the future burden of disease. Hypertension is not just an individual problem, it is a public health challenge that affects productivity, healthcare costs, and quality of life. Heart disease and stroke related to high blood pressure are among the leading causes of death worldwide. Yet, many of these deaths are preventable. Early detection, consistent treatment, and healthy lifestyle choices can dramatically reduce the risk. Knowledge empowers people to take control of their health, and awareness transforms communities. In conclusion, hypertension truly deserves its name as the silent killer. It develops quietly, progresses slowly, and strikes suddenly when least expected. However, silence does not mean inevitability. With regular blood pressure monitoring, informed lifestyle choices, proper medical care, and strong community support, hypertension can be controlled and its devastating consequences prevented. Understanding this condition is the first step toward protecting the heart, the brain, the kidneys, and ultimately, life itself. This is why hypertension is something everyone must know about, talk about, and take seriously, before it becomes a silent threat too late to stop. Don't forget to like, share, and subscribe. It helps this video reach more people who need this life-saving information.